Okay, it is Wednesday, I think, June, I want to say 18th. It's like 2 or 3 in the morning right now, so I don't really know exactly what time it is, but I couldn't sleep for whatever reason, which is not a problem that I have often, but these days. But I had some things on my mind, so I wanted to kind of get some basics out there. Um, and I'm getting a lot of questions and a lot of the same questions, a lot of suggestions, a lot of rah speeches, a lot of like encouragement to stay positive and keep fighting and all these things that these sort of platitudes that we say to cancer patients. And I do appreciate people reaching out and checking on me and stuff like that. It does get a little bit tiresome to continually say, like, no change. I still feel sick, I still feel tired, I still am not working, I still am struggling every single day, because I know that people want to hear good news. And right now, it's kind of like no news is good news, I guess. Um, but yeah, and people asking me what I'm like doing with myself since I'm not working and I must be so bored. And in a way, I guess, yeah, I'm bored, but um, I'm bored because I'm sick. I'm not bored because I like need something to do, I guess. I don't know. Um, I'm also getting over a really bad cold. So there's that. um, but yeah, so I wanted to cover like some basics of, and I have notes here, so like it's a whole thing. Um, like, what do I have? What's my treatment? What are the side effects? How long will I be in treatment? What's my prognosis? Uh, how am I spending my days? What does the future look like? And how this diagnosis is different from the first one. So I'll start with what I have. So I have what is called metastatic breast cancer. It is stage 4 breast cancer. So it's, I hesitate to say the worst case scenario, but it essentially is the worst case scenario. I'm not actively dying at this point, but I am in the early stages of my first line of treatment. Um, there is no cure for this. My first time going through this was a curative goal, and we did technically achieve that. I was no evidence of disease for 3.5 years. Um, my first diagnosis was in 2019, technically. I went through treatment in 2020, all during like the big COVID time. So that was pretty unique. But yeah, right off the heels of a deployment to Kandahar, Afghanistan, I noticed something while I was there, just a dimple in my skin, and it turned out that dimple was caused by two tumors in my right breast that were like fighting for territory, basically. And so they were kind of pulling my skin in, and so there was that like divot of a dimple. And it had already spread to my lymph nodes. I think they took out like 19 lymph nodes or something, and 16 of them were bad or something like that. It was not an insignificant amount. And luckily there was maybe a tiny spot on my scapula as well. But otherwise it was pretty much just um, localized to the breast and the lymph nodes. So I went through chemotherapy for 5 months or 4 or 5 months, all during COVID. And then I had a single mastectomy, and then I had radiation, like a month or so of Monday through Friday radiation. And then I was on aromatase inhibitors, and I couldn't tolerate those. And then I was on tamoxifen for a time. Kind of went on and off of it just because of side effects, and like I was just done being a cancer patient, and I wanted to move on with my life. And so that was a constant battle, and that's one thing I wish people understood about my situation, or really breast cancer in general. It doesn't just end, especially when it's hormone receptive, which mine was. It doesn't just end when your hair grows back, or when your eyebrows grow back, or when your eyelashes grow back, or when you go back to work. A lot of us are still on endocrine therapies and hormonal therapies for a considerable amount of time after, 5 to 10 years in a lot of cases. And it's a lot. And, that's something I really grapple with, because I feel like I had like one summer where I felt like I was no longer a cancer patient, and I made a career change, and like it just felt like everything was getting back to normal. And so from 2019 to 2023, that's the time it took for me to like start feeling normal again. And then now, unfortunately, I have a recurrence, and I have to be very clear about this, that it is not bone cancer. It is stage 4, aka metastatic breast cancer. So the reason it's not bone cancer is because it's not a primary bone cancer. The primary cancer was breast cancer. And so different cancer cells react or perform, whatever, proliferate in a particular way. They all have their own like signature brand, so to speak. And in my case, my breast cancer was essentially eradicated, for lack of a more technical term in this case. But so I enjoyed being no evidence of disease for 3.5 years, and then I started having hip pain at the beginning of 2024. And come to find out, after a series of ER visits and different imaging centers and stuff, we found that my cancer is back. And again, it's breast cancer that has now metastasized or moved to spread to my bones. So it's all across my pelvis. A significant amount of tumor was centered in my right hip, my femoral head, and neck, and a little bit of my actual femur as well. So that was the most like painful part of this whole situation. And so yeah, all across my pelvis, my right femur. It's also in my left femoral head as well, just not as extensive as the right. And my thoracic spine, my lumbar spine, my left clavicle, and my skull, I think, is all of the places that it is. And so we did, so in terms of treatment, again, there's no cure for this, but I'm considered in my first line of treatment, and it's considered treatable at this point. It really is like living your life 3 months at a time. and sometimes even day to day, but for the most part, 3 months at a time, because that's about when I'll have scans and things like that every 3 months, for the foreseeable future, so we can monitor what all these treatments are doing for me. And so, treatment, so perfect segue, right, onto treatment. It's not a typical like situation like I went through the first time, where it was like chemo or surgery first. I had chemo first, then I had surgery, then I had radiation, and then I continued on or endocrine therapies. That is not going to work this time. So they don't typically do IV chemo for my situation. Instead, we immediately started me on Lupron shots. So I get a Lupron shot every month, and that's to shut down my ovaries because my cancer is hormone receptive. So if there's any estrogen or progesterone floating around in my body, my cancer cells attach to that, and that's how they proliferate. So there's Lupron a monthly shot. I'm on a study drug that is a pill, 2 pills, so a 30 milligram and a 60 milligram every day. Another drug called ribociclib, which is a standard of care drug for treating breast cancer. I take Ativan for the nausea associated with taking my meds. A blood thinner, because apparently you're at higher risk for blood clots, and I had a blood clot in my port the first time I went through all this. And then Zometa, which is an every 3 month. I negotiated my way into every 3 months instead of every month, because I had a really bad reaction to the first infusion last month. But Zometa is a bone strengthening agent. It's a bisphosphonate, so one of the major side effects or major risks of side effects is osteonecrosis of the jaw, which is terrifying for me because I have a long history with tooth number 30, and I have a dental implant that I received after losing the tooth during chemo the first time. So long story short, Zometa gives me great anxiety, but at this point, it's another one of those, the benefits at this point outweigh the risks. I declined it the first time because of my concern for the bone loss and infection and things like that. But this time it's my bones are so brittle and at risk that I have less of a choice, I guess you could say. There's always a choice, but I opted to try it out this time. So yeah, so the side effects of all the drugs, Lupron puts you into menopause essentially, and so I'm just hot flashing and night sweats and brain fog and all those things. But I went through this once already. Like, it's crazy. I went through menopause now twice because my body like came back to life basically after I went off of Lupron for a time. And the side effects of the cancer drugs, so the study drug and the ribociclib, are nausea. I threw up a few times. I never threw up during IV chemo, which is crazy. But they throw a lot of drugs at you to combat side effects. This time, I can't really tolerate those same drugs like I could before, or like it was different. It was just a different mindset, knowing that, I only had 5 months of misery in chemo the first time, and now it's essentially for the rest of my life. So that's another thing to note about treatment is there is no end to treatment. When I stop treatment, that's when I'm dying. And, or that's when I will die. So again, no cure. I will be in treatment essentially for the rest of my life, however long that may be. And yeah, so which brings me to what's my prognosis. I know people are wondering. I've only had a couple of very brazen people ask me that. And my prognosis is kind of up in the air because generally speaking, like I'm 20 years younger than the average age for this disease. So so it's hard to say. It could be 5 years, it could be a year, it could, if this line of treatment doesn't work, it could be quicker. And it could also be 20 years. We have there really isn't a lot of great data to track women like me who are as young as me with this disease. And so the literature says that survival rates for women with metastatic breast cancer, first 5 years is about 20-30%. I think 30%. 10 years is about 13%. So again, that's for, women who get this at 60 and not every 60-year-old has 20 years to live anyways. So are they dying because it's breast cancer? Or are they dying because, old age? I don't know. I don't know enough about the literature, the science to really understand that. And it doesn't seem like anybody can really satisfactorily explain that to me. Because again, there's just not, I guess the data is just not there. So that's something I'm curious to learn more about. But yeah, so how do I spend my days? I sleep a lot. Getting up with my dogs at 5 a.m. and walking them as often as I can and feeding them, making sure that they're taken care of, really kind of takes it all out of me. Showering, feeding myself, like all that stuff has really has become quite laborious. And like that's the crazy part about all of this is, like December, I was perfectly healthy. On the outside, I was physically strong. I was playing, sand volleyball with a bunch of 20-something-year-olds in Mississippi for work, and without really any issues. I was running on the beach. I was doing all the things, and in I don't know about 2 months, I was in excruciating pain and exhaustion, and I'm still there. I also had radiation. Forgot to include that in my treatment plan. But yeah, I had radiation to the hip. The reason they can't radiate all the other places is because you only get like one shot, right? Like Eminem says, you only get one shot to radiate a bone. So radiation is so incredibly destructive, and it continues to work long after the actual treatment is done. So we opted to radiate just the right hip, and I had a lot of side effects from that. That radiation really took me down this time. But it worked, and I was supposed to have a total hip replacement, which I've noticed a lot of people are treating that as like my primary complaint. And at the time, like in the beginning of all of this, that was the biggest thing, I guess, going on, or like the closest alligator to the boat was my hip. And now it's not so much my hip anymore. And so yeah, so we're still figuring out if I'm gonna need surgery or not. I am leaning towards no, but we'll see what ortho says. I think I see her on Friday this week. So yeah, sleeping a lot. It kind of takes everything I have to get myself ready for the day. Take a shower, brush my teeth, do all that stuff. And I don't think this will be forever, but I definitely it's definitely taking longer to sort of even out, I guess, than I think it did the first time. So yeah, and then for 4 hours a day are kind of taken up with like timing my meds. So whenever when I wake up, I try to eat something right away, and then I have to fast for 2 hours to take my meds, and then I have to fast for an hour after the meds. So wake up, eat, wait 2 hours, take meds, wait an hour, eat again. Otherwise I will be absolutely sick. We've already lowered my dosage once, which I get asked a lot. Well, is it going to be as effective? Yeah, they're not going to lower my dose to an ineffective dose. They'll tell me we can't lower it anymore, or else it's just pointless. So, these doctors know what they're doing. And so, yeah, so it's, that's 2-3 hours, that I have to like kind of know where I'm going to be in that time. So I try not to schedule anything in the morning. I try to schedule everything in the afternoon, because then I can, spend the morning timing out meds, dealing with any side effects that happen. They happen pretty quickly. If they're going to happen, they happen pretty quickly after I take the meds. And then, schedule things for the afternoon so that I can then kind of use those things like doctor's appointments and stuff as sort of a distraction, so that I don't have to worry about like feeling sick. I noticed that distraction does help. I try to take a walk after I take my meds. It's been really hot lately and I've been sick as hell, so haven't been doing that. But yeah, and then otherwise it's just I'm trying to plan my meds around my life instead of my life around my meds, because I need to be able to live my life, right? So outside of that, because I'm in a study, I have a lot more appointments than even just the average breast cancer patient. So I am seeing the doctor or a nurse practitioner. I'm having labs and an office visit it was like every week, and now I think it's every other week. I was out of town last week, so I think I can't remember if we skipped a week because of that, or if I'm just on that. I'm on cycle 3 now of my little study here. So yeah, so anyways, the doctor's appointments and labs every other week, and they're not always on the same day, and because the study, they have to have labs on like certain days of treatment, and it's a pain in the ass, but I wanted to try it because it's, you know, one of the most promising things out there right now, and really grateful for that opportunity to have access to things like this. And I have great insurance, and, you know, I worked my ass off for all of these things, and so I'm grateful and proud of myself for the life that I have been able to build doing what I do. So what else? I spend a lot of time just thinking, which some people might think is not morbid, but counterproductive. But for me, it's not, because I'm a processor. That's just how I am. And I have to think things through as much as I can. And I'm doing that. And so I the first time writing was my absolute favorite thing to do. I looked forward to it every single day. This time writing has become a little bit difficult, and not really sure why, aside from I think my brain is just really overwhelmed. And so, you know, all of the encouragement to think positively and look on the bright side, and, you know, all these things that really are not helpful to me right now, or like asking me, what are you doing to keep your mind occupied? Don't fucking worry about that. At this point, my mind is plenty occupied with the bare minimum. Like, I'm in survival mode right now. My brain is occupied with just the bare minimum of getting myself, like, hygiene and dogs, and getting myself to appointments, or finding a ride to appointments sometimes. I was on crutches for 3 months, so that was really hard. And, you know, my mind is tired. And I'm also really tired of continuing to say, I'm doing okay, or it was a rough week, or I'm still just really tired, or, you know, it's the same thing over and over at this point, and I don't know what else, like, what to suggest that people do otherwise. I mean, I appreciate people checking on me and all of that. It does feel overwhelming sometimes, but, you know, it's, consider the alternative. It could be a lot worse. Could be a whole hell of a lot better too, but could be a lot worse. So yeah, the future, what does the future hold? I don't know at this point. My scans, my 3-month scans, I had my first 3-month scans at the end of May. The results are confusing as shit to me. The bone scan says no change, no like marked change, no significant change, which is good. No change is good. It's better than getting worse. It's not no evidence of disease, but it's better than, you know, better than getting worse. So the bone scan said that, and then the CT said, and like, I'm starting to get really frustrated about this too, because I don't know how radiologists can get away with doing this, putting in the report, worsening osseous, I can't remember exactly what it said. It was like worsening osseous metastases or something. I don't know, something like that. Bottom line, it said worsening. And so I'm reading this, you know, and trying to take it with a grain of salt, because I freaked out one time, and my doctor, my actual oncologist, my medical oncologist, she explained to me that radiologists don't have the whole picture. They don't have the clinical correlation to go with the images. And so they're interpreting something without any context, completely in this like little radiology bubble in their little dark room, and they can just say whatever they think they see. And then that result gets published to my chart, and I read it and I'm like, oh shit, I'm dying. And turns out, oh no, you're not. So I had lytic lesions to start with, and now I have sclerotic lesions, which is like, the way I understand it, is lytic is active disease, sclerotic is like scarring or healing, attempts at healing, I guess. So I don't know. I'm still like kind of not super satisfied with the explanation or the interpretation of my scans, although I do know that I feel better. And I hesitate to say I feel better, because I feel like when I say something like that, people hang on it. And I could feel fine right now, and then in 20 minutes, I want to throw up. So when I say, I'm feeling generally better, I feel like people just grasp onto that and kind of take it to the bank, and they're like, oh, she's fine now. And that happened to me the first time I went through it, and it's happened to me now again. And I really want people to be as realistic as I am about it, where I don't know, what's really going on inside my body. I don't know how long I'll be around. But what I am able to focus on is like being realistic about how I'm feeling whenever someone asks me. So I never say I'm doing great, because I'm not. I'm just not doing great. And like, I'm just trying to balance reality with living well and figuring out how to live well with this disease, because we're sharing a body. So we got to figure out a way to live together, I guess. But yeah, it's a very different experience from the first time. The first time I was very gracious and like, I don't know, I don't want to say stoic, but like, I was just very not resigned. I don't know what word I'm looking for, but I just kind of rolled with the punches. And I knew that it was my time to rest. I knew that it was my time to, and granted, I still continue to work like a crazy person. And this time it's very different. I have less ferocity, I think, in my aggressive approach towards this. I walked into it once again, wanting to be very aggressive about treatment and doing the hardest one, or the most effective one, which happens to be the hardest. But I don't know how long that will hold up. So, yeah, we will see. I hope this was helpful, and it's a little bit long, but I really hope it was helpful, and I'll get into further detail of like, I don't know, anything. If you have questions, ask. If I feel like I'm able to engage or I'm able to answer, I will. If not, I won't. So, yeah, onward.